about their concern in 5 minutes, so take it away.
Thank you, Selena. As the healthcare specialist for the New York League, I'm one of the sponsors of our healthcare concurrence, which will add to the current US position, not change its language. So our current national goals will remain unchanged. Healthcare that is universal, meaning equitable access to needed care with no rationing by class, race, health, or home address. That provide equitable, high quality care regardless of patient location, disease, or demographic. Affordable and feasible for all, patients, taxpayers, and providers, where the poor pay less than the rich. A lot has changed in the 29 years since we adopted the current healthcare position, plus behavioral health by concurrence in 2016. Since 1993, we've seen healthcare costs triple, and that's in constant dollars. The percentage of workers with job-based insurance is now about half of what it was, and with far less coverage. Our health outcomes relative to international peers are worsening. US maternal mortality has almost doubled since 1990. Our peers have cut maternal death in half. We have more healthcare deserts and worse life expectancy, while costs increasingly burden our economy. Healthcare is now 20% of our GDP, up from 12%. We pay more in taxes for healthcare than our peers, and they cover everybody. Next slide. At convention, you will vote on concurring with excerpts from 2 healthcare positions adopted by New York League in 2021, following 2 years of study and thousands of hours developing extensive study materials. New York State Local League from all regions of the state were nearly unanimous in their support. So what benefits does voting yes give you? 4 highlights of the new position clarify language or logic in our current position. They don't change what the National League supports. So protecting the vulnerable and public health. The pandemic has shown the only way to protect public health is give everyone access to health care. Supporting single payer funding, which our position currently supports. That's the US position. New York State makes this support explicit and connects it to the League goals of universal, equitable, affordable access. Supporting states to be laboratories of democracy, allowing states to enact programs that achieve National League goals within League guardrails, and calling for regular assessment and transparent administration of healthcare programs, language not currently in the US health position, but in our positions on privatization and the citizen's right to know. Last slide. The position also supports new issues that will allow state and local leagues to advocate for specific reforms not currently supported at the national level, all of which has significant DEI implications, requiring all cost controls to show evidence of reduced total cost and not exacerbate disparities in outcomes. Expanding delivery options, such as telemedicines or clinic in school, while ensuring standard of care and health promotion. Separating healthcare access from employment status, a uniquely American problem the pandemic exacerbated. Ensuring safe staffing, the ratio of staff to patients for both staff and patient safety. And finally, respecting healthcare decisions made by patients, their families, and providers, even those made prior to need. At the bottom of this slide are some useful links to the Healthcare Concurrence website, which includes the actual wording of the proposed concurrence statement, the 50 pages of 50 heavily footnoted study materials written by the study committee with many peer-reviewed academic citations, the new New York State positions, and a presentation on this proposed concurrence that we presented for the League of Colorado and is now on our YouTube site. Finally, if you or your League members have questions, comments, or concerns, please email us. Thank you so much.
Thank you, Judy. Now you guys see why this was like one of the recommended concurrences. It's chock full of information that's super helpful for League. So thank you, Judy, for educating us on the healthcare concurrence. For